Assalamu alaikum. Bismillahirrahmanirrahim. Today, the topic of my presentation is Health System Frameworks under kind supervision of Professor Dr. Saira Afzal. The quote of the day: you have to fight through some bad days to earn the best days of your life. Learning outline of my presentation is there are different model of healthcare system which we discussed today, like model of care, biomedical model of care, organizational model, health system framework, WHO building block, international health partnership monitoring and evaluation framework, the World Bank flagship program, control node frameworks, recent advances, and at the end, there is an MCQ session. By the end of this presentation, participants will be able to describe about the health system objective and functions, model of care, health system framework, WHO building block, international health partnership monitoring and evaluation, and the World Bank flagship program control nodes. What is health system? All the institution, people, and action whose primary purpose is to improve health. And the objective of health system is improving people health and well-being, responding to people expectation, and providing protection against the cost of ill health. There are different functions of a health system like governance, financing, generation of resources, and service delivery. There are different domains which are covered in the health system, different participants. First of all, the patient is the main target in the health system, and the care team in which frontline care providers, healthcare professionals, family member, and others. And then comes the organization. And in the organization, there are different infrastructure and resources like hospitals, clinic, nurses, and homes. And then comes the environment in which regulatory authorities, market, and policy frameworks include. There are some major systematic challenges which are faced in the health system is the segmentation and fragmentation. In the fragmentation of health system relates to the coexistence of several units or facilities that are not integrated into a single network and or services at different levels of care that are not coordinated among themselves. And in the fragmentation of a health system is responsible due to poor performance, barrier to access, poor quality, irrational or insufficient uses, high cost, and low satisfaction of patients. What is care? Care defines healthcare delivery that does not cover the entire range of promotion, prevention, care, and rehabilitation and palliative care services and or services that do not continue over time. How we address the fragmentation. A fragmentation of care is addressed by a different models like new model of care, fragmentation of services, new ways of organization and managing healthcare delivery services. What is universal access to health and universal health coverage in health system? Universal access. Absence of geographical, economical, socio-cultural, organizational, or gender barriers that prevent all people from making equitable use of comprehensive health services. Now, what is universal coverage? Universal coverage is defined as sufficient organizational mechanism and financing to cover the entire population. Universal coverage in itself is not sufficient to ensure health, well-being, and equity in health. There are 4 simultaneous or independent strategic lines in health system like equitable access to health services, increasing financing with equity and efficiency, strengthening intersectoral coordination, strengthening stewardship and governance. This is the model of care, and the model of care is responsible for governance and stewardship, financing, and resource generation. And it leads to organization and management and services benefit. These are the health services. Now, there are the transitioning of the model of care in two systems, biomedical model and primary healthcare based system. Values of the biomedical model is health is as a privilege, a commodity, or act of compassion. And primary health system, health as a human right, equity, or solidarity. In biomedical model, there is a focus on the patient, but in primary healthcare, the main focus on people, families, and communities. In biomedical model, there is a doctor-patient relationship, and in primary healthcare, there is multiple involvement of a different system. And in financing, payment to provider and profit-oriented, and it is the in if the domain universal health coverage and social protection in health. Provision of services in biomedical model is acute, episodic, and curative care. And in the primary health care, it is comprehensive health and social services. And the development of resources in biomedical model, physician, nurses, and other professionals taken to curative care technologies as a business tool. And in the primary healthcare, there is a wide range of profession and competencies, appropriate and equitable use of technologies. Biomedical model is a linear in its systematic approach, and primary healthcare is complex adaptive system. Biomedical model of care, it is centered on acute episodic care, supply driven and organized by level that fragment care, hospital based and depend on costly technologies and specialist care, provisions of curative services through fragmented process of care, lack of continuity, poor quality and safety, inefficient referral system, and generates of exclusion and dissatisfaction. Now comes the radar phenomena. What is radar phenomena? The patient is shown up, the patient is treated, and then the patient is discharged, and then the patient is vanished. There are different pushes that need to change the health services. Like there is a change in demand in the context of demographics, epidemiology, and people's expectation. And then there is a change in offer like knowledge and technology, workforce issue, and financial pressure. And then comes the social changes due to globalization, reforms of the state, and sectoral reforms. And these all changes ultimately change over health services. Now comes the integrated health service delivery network, defined as a network of organizations that provides or make arrangements to provide equitable, comprehensive, integrated, and continuous health services to a defined population and is willing to be health accountable for its clinical and economic outcomes and the health status of the population that is served. What is health system framework? Health system framework is a support structure or system that holds part together, has something stretched over it or act as the main structure, used to describe, explore, explain, and analyze health system. Why healthcare system framework is needed? Achieve more equitable and sustained improvement across health services and health outcomes. Now comes the WHO health system framework, system building blocks, service delivery, health workforce, health information system, access to essential medicine, financing and leadership and governance. And it leads to access, coverage, and quality safety. Overall goals that achieve by these system building blocks is improved health, responsiveness, social and financial risk protection, and improved efficiency. There are different strengths and weaknesses of WHO building blocks. All health systems have multiple goals. Thinking health systems require consideration of horizontal management and support function and resources as well as services and programs. And the weakness is there is no sense of interaction among blocks, no explicit recognition of the people relationship within and across blocks or what drives them. Citizen users are absent. And in the local health system is the implementation or roles. For example, for the district health management team, 10 essential functions are required: diagnostic and investigation of health problems, policy and development plan, resource management, healthcare delivery regulation, operational research, quality healthcare delivery, partner mobilization, monitoring and evaluation, coordination and supervision. In the local health system is a system of in which the four units is occur in which intrants, processes, output, and impact. In intrants, there is the legal and regulatory framework, directive norms at standard, and there are different policies. Resources like ICT equipment, drugs, and funds. Local health system in which the process is institutional arrangement, information flow management, platform of management, management procedures, district health management team functionality, redevelopability. And in the outputs, there is healthcare delivery and impact. Overall impact is access, improve the quality, improve efficiency, and there is the use of services. Towards a common monitoring and evaluation framework. InTrust is a common monitoring and evaluation framework was stimulated as a result of international health partnership and related initiative. Launched in September 2007, the IHP aims to better harmonize donor funding commitment and improve the way in which international agencies, donor and developing country work together to develop and implement national health plan. The International Health Partnership has developed a common monitoring and evaluation framework to enable targeted monitoring and evaluation of health system and strengthening effort. This framework is country focused and supportive of country needs while also providing a basics for global monitoring. The monitoring and evaluation framework shows how health input and processes are reflected in output, then in turn are reflected in outcomes and impact. The added value of framework is that it brings together indicators and data sources across the result chain in its entirely, from input and processes, output and outcome, and then the impact. It is designed to address monitoring and evaluation needs for different users and multiple purpose, including monitoring of program input, process, and result required for the management of health system investment. Health system performance assessment as the key for country decision making process and evaluating the result of health reform investment and identifying which approaches work best. Health system framework. The International Health Framework builds on 2007 WHO framework, noting that its category of input and process consists of WHO building block. The framework is used to identify indicator of WHO building block and associated sources of data, including household and facility surveys, routine health information system, vital stat, and census. There are some characteristics of all these complex systems. Most systems, including health system, are self-organizing, constantly changing, tightly linked, governed by feedback, non-linear, history-dependent, counter-initiative, and resistant to change. Feedback loop. There are different feedback loop in which role of supervisor, and then comes the provider, and then there is a patient. So these all are interlinked with each another. Health system intervention have unpredictable paths of implementation. It is a complex system. There are different levels in which health system work, and these levels are micro level in which global and national context occur. Then comes the micro level in which different policies, health manager, providers, patient, and citizens, domestic health system. And then there is a meso level in which the organization and local level comes. Now we discuss another framework, the World Bank flagship program Control Knobs Framework. Robert et al. Published a framework to assess health system performance and guide health system strengthening efforts. This approach was jointly developed by the World Bank Institute and the Harvard University School of Public Health and is taught in the WBI run flagship program on health sector reform and sustainable financing. The focus of this framework is to identify area of policy action to modify health system and improve their performance. This framework identifies 5 control knobs that can be adjusted, changed to strengthen the health system. The control knobs are discrete areas of health system, structure, and functioning. And these 5 knobs are financing, payment, organization, regulation, and behavior, which can be adjusted by various country actions. And the benefit of these knobs to improve health system performance in the domain of access, coverage, efficiency, quality, and equity, and to ultimately achieve long-term positive outcome in the domain of health status, client satisfaction, and risk protection. In financing, deals with the mechanism which mobilize money to fund healthcare and how it is allocated. And in payment, look at how providers are paid and incentives or disincentives this creates to influence performance. And in the organization, how healthcare delivery systems are organized and management. These are the corrective requirements imposed by the state. And in the behavior, this control knob is around influencing the behavior of provider and consumer through population-based intervention, since these are grounded in social and cultural structures. These are the 5 knobs of health in this control program: financing, payment, organization, regulation, and behavior. And then comes the intermediate performance measure in the context of access, quality, and efficiency. And then comes the performance goal in the context of risk protection, customer satisfaction, and health status. The World Bank flagship program control knob. The inclusion of behavior control knob, which include a mix of behavior that influence both positively and negatively the health of individuals, communities, and broader society, is a useful contribution. Provides further evidence of health system analysis, acknowledgement, and vigorous commitment to the need for behavior change at all levels of the health system for continued growth and development. And in this slide, these all are control knobs. And in the end, there is a WHO approach in which we cover the health status, responsiveness, and finance in financial contribution. How stakeholder perspective can vary. A health system is a profit-making system for the perspective of provider. It is a distribution system for the pharmaceutical industry. It is an employment system for health worker. It is a market system for the perspective of household consumer. It is a health resource system for the perspective of client. It is a social support system for the local community, and it is a complex system for the researchers, and it is a policy system for the government, and it is the subsystem for the Ministry of Health. All these conceptual framework provide the basis for understanding, investigation, and strengthening the health system. No easy answer to how we improve a health system. Politics and values matter. Now comes the recent advances. WHO agenda, strengthening health system to improve health outcomes. And how we strengthen the health system. It is a diagonal approach for health system strengthening, taking the desired health outcome as the starting point for identify health system constraints Addressing health system water in each way that specific health outcomes are met while system-wide effects are achieved and other programs also benefit. Addressing primary health system policies and capacity issue, encouraging the development of national health sector strategic and plan, reducing investment in isolated plans for specific aspect of health system, and robust monitoring and evaluation framework. There is a list of multiple health system framework which exist up till now. Actor frameworks, funds flow and payment framework, demand supply framework, performance framework, control nodes framework, reforms framework, public management framework, capacity framework, building blocks framework, and essential public health functioning framework and system framework. Strengthening health system to improve maternal, neonatal, and childhood outcomes. And this is a diagram which shows different health system control node which is required for the strengthening of maternal and child health system, in which we strengthen the healthcare sector and the community is also strengthened, and household and coverage and quality of MNCH intervention and impact on, and then check the impact on maternal, neonatal, and child mortality and morbidity. Health system strengthening is discussed in a literature review. Framework for health system intervention. Given the vastness of health system, we do not carry exhaustive search for framework for monitoring and evaluation of specific intervention. Among these identify are the following: health insurance, integration, decentralization, contracting, hospital autonomy, and routine health information system. And the conclusion, research yield useful approach that can be divided into two journal type tools and guidance to conduct monitoring and evaluation on a broad range of health system activities, and tool and guidance focus in specific type of health system intervention. In journal, the guidance on monitoring and evaluation extensive for those who plans to conduct health system monitoring and evaluation, including field staff. Sorting through its material to identify useful resources is not an easy or time-efficient task. This reviews narrow the choices and makes the task easier. There is an article, Health System Goal, a discrete choice experiment to obtain societal valuation. And the conclusion of this article, over frameworks add to the World Health Organization, we demonstrated the feasibility of measuring societal valuation of health system goals with a multi-tutorial technique based on a trade-off. Overweight placed much greater emphasis on health and health inequality that on process outcome. Overstudy improved the methodology of international health system performance comparison and thereby enhancing global evidence-based health policy information. Now it's time for the MCQs. Health spending would be increased from 5 to 10% government budget in 2017, according to the XYZ country declaration on tuberculosis and other related infection disease, which was signed by country leader from XYZ in 2017. It served as an illustration of which component of healthcare system works: leadership and governance, health information system, health financing, health workforce, medical products and technologies. C is the correct answer, health financing. A cholecystectomy patient on a hospital waiting list were surveyed about the willingness to pay for laparoscopic rather than conventional cholecystectomy by a group of public health students. This survey is concerned with the concept of in healthcare, achieving average level of health, equitable distribution of health, financial risk protection, process utility, time utility. C is the correct answer, financial risk protection. Government has formulated a policy and increased the tax amount of cigarette to decrease the purchasing power of customer. Which level of health system this fall? Macro level, meso level, micro level, primary level, global level.
B.
A is the right answer, macro level. An XYZ country has increased the burden of maternal death in basic health units from the last 10 years. Healthcare delivery of XYZ country covers the entire range of promotion, preventive care, rehabilitation, and palliative care services and or services that are not integrated into a single network. The major cause of increased maternal death is cultural barriers to health, accessibility, fragmentation of healthcare, high cost of health services, inequality, poor quality of health services. B is the right answer, fragmentation of healthcare. In 2020, the ABC government launched a 5-year program to train medical officers to perform surgical procedures in places where consultants were unavailable. These include pregnancy-related problems, trauma-related complication, and acute inflammatory disorder. It is an illustrative of which health system component: leadership and governance, health information system, health financing, health workforce, medical products, and technologies.
B. B.
No, D is the right answer, health workforce. A model of care in any developing country is what healthcare services will be delivered to fulfill the ABC country population health requirement, desire, and expectation. Which of the following model will be required for delivering services in response to the ABC population health requirement desire? Beveridge model, Bismarck model, National Health Insurance Organizational model, out-of-pocket model. D is the right answer, organizational model. Surveys show that one of Pakistan's most problematic areas in healthcare system improvement have been slower than in comparable countries. The primary healthcare delivery challenge is cultural barriers to health accessibility, fragmentation of healthcare delivery, high cost of health services, inequality, poor quality of health services.
B.
B is the right answer, fragmentation of healthcare delivery. The International Health Partnership has developed a uniform monitoring and evaluation framework for health system strengthening project. This framework is both country specific and global in scope. This framework additional value is that tools that gather health indicator and data from several sources to get a result, tool that address the fragmentation of healthcare, tool that address the high cost of health services, tool that consider the horizontal health management, and tool that address the cultural barrier to health accessibility. A is the right answer. Globally, tremendous success has been made in delivering intervention to improve mother and child health and reduce HIV and AIDS, tuberculosis, and malarial mortality and morbidity. The WHO six-pillar frameworks contributes to strengthening health system in various ways. The major weakness of WHO six building block is absence of health financing component, absence of health workforce, absence of leadership governance component, consideration of horizontal health management, lack of substantial and dynamic interaction between six building block. E is the right answer, lack of substantial and dynamic interaction between six building blocks. Dr. Akbar, a student of PhD Public Health, wants to research the response of health system failure on HIV and AIDS by studying the social risk factor and behavior of health consumer behavior of health consumer and provider in XYZ country to explore why and how government can do better, which health system framework will be used: biomedical model, Bismarck model, flagship framework with its 5 control of Organization for Economic Cooperation and Development, revised WHO health system framework 2000. C is the right answer, flagship framework and with its 5 control knob. This is the key of my MCQs. This is the YouTube link of my presentation, and thank you.